All right, good afternoon. I'd like to welcome and introduce again Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. And we continue to invite you to submit your questions to us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion today again is Katie Berg, who is an intern this summer with the Institute for Global Health. And Katie, I now turn it over to you.
Thank you so much, Kristen, and thank you all for submitting your questions. We really appreciate it. And again, thank you, Dr. Murphy, for being here and answering those questions. Today, we start out with some headlines that were surrounding breakthrough infections and some confusion about the vaccine. So we had a lot of people kind of wondering, why have the mask mandates changed and why would you still get vaccinated if you can still transmit Delta?
Well, it's very simple. It's that Delta is very different. It's highly transmissible and it is more aggressive. Now, whether it causes more severe disease, we're not quite sure yet. There is some suspicion that it does, but one thing for sure, it's highly transmissible. So transmissible that it can even transmit to people who are vaccinated. Now, the good thing is that the vaccinated people, even if they get it, rarely end up in the hospital and nobody dies. Basically, nobody dies, 99.9% chance of survival. So they work and they prevent about 90% of the disease, but they can get infected.
Mm-hmm. And do you know if those breakthrough infections are being studied yet in trials or just looked at?
Yes. There's an intense interest in the outcomes of the Delta virus. There have been many anecdotal reports that younger and sicker and quicker and all this kind of stuff. Part of that is just the natural infections that occur when you've taken out. Over half the population is fully vaccinated. And so they're going to have a very different outcome, especially the older people who are more likely to die from COVID. It's approximately 80% of those people are vaccinated already. So if you remove that, what you have is, the disease is going to look very different. Obviously there's going to be more younger people and people who are otherwise healthy, including even a few vaccinated people. And so it may just be, this is the pool that's most at risk instead of this is really a different disease. It's of a debate and it's an intensive study right now to look and see if this is really true, that this disease is more lethal and a nastier disease. There is some suggestion that it may be a little worse, but if so, it's really incremental. If that's true, it may not even be true. But one thing to keep in mind, it's highly transmissible, maybe exposure less than 1 minute, and the vaccines do work.
Mm-hmm. And speaking about a more vulnerable group, that cannot yet get vaccinated, which is school children, elementary school children specifically, do you expect to see that we'll have masks in all schools in Illinois?
Well, the governor announced yesterday that every school kid in Illinois, public and private, everybody in the schools is to be masked. He's following the American Academy of Pediatrics, which had their policy put out several weeks ago, which was in contrast. It was more conservative, more strict than the Centers for Disease Control. But now everybody, because of Delta and so much virus spreading, everybody has come around, all the experts on the same page now. And the governor of Illinois and many other governors as well have come to the same conclusion that this is the best way to go to slow down this freight train of infection.
Right. And because there have been so many cases, do you know if we've been seeing any higher vaccination rates across the country because of those cases?
Yes, I mean, one of the silver lining in this disaster here is that the vaccination rates have been creeping up. And that is certainly good news because it's the only way we're going to be able to really control this other than wearing masks all the time when we're indoors.
Mm-hmm. Great. And switching over to some of our viewer questions for the week. A viewer and their coworker back in October of 2019 became really, really sick with something they'd never experienced before, had never been that sick. And the viewer actually took a sample of their mucus so they could possibly test it when that became available. And do you know if that's possible to test this older sample?
No. The samples over time are going to degrade, especially RNA degrades very quickly. And those samples have to be frozen at -80 Celsius in viral transport media, basically. So unfortunately, the sample that they've saved is not going to be very helpful.
Mm-hmm. Wow, that's very, very cold.
Yes.
Freezing.
Welcome to the world of laboratories.
Ooh. So another viewer is having their house painted and has found out that the painter actually is not vaccinated. And currently the painter was working on the outside of their home, but they were wondering, should they let the painter continue with their work on the inside of their home?
Well, outside, it doesn't make any difference. I mean, you're not going to be with the painter. But I mean, you don't want to be coming up to the person, when they're off the ladder or whatever and dealing with them without everybody wearing a mask. But it's okay to do the outside. If you bring that person, an unvaccinated person, to work indoors, you should mandate that person be vaccinated. And you should still wear a mask. All right, because you're bringing a stranger into your house, a person from outside your family bubble. And it's not a good idea to be unmasked in that situation. Now, if this person is not going to get vaccinated, you have a choice. You could just put off painting the interior of your house until you find a painter that is vaccinated, or you wait till the pandemic sort of burns out or goes away, whatever, however long that may take, or you take a little bit of a risk and everybody wears masks and you try to stay away from that person as much as possible while they're working. So there's no right or wrong answer. It's just how much risk you're willing to accept. But keep in mind that if you have an unvaccinated person in your house, even with a mask working, there is some risk. So it's up to you.
Right, right. And do you know if there's any transmission of COVID between people and their house pets? Has there been any evidence of that?
No, they've found coronavirus in different animals, but there have really not been any outbreaks related to pets that have been reported that I'm aware of.
Mm-hmm. Wow, great. We had another viewer wondering if for vaccinated individuals, it's still safe to gather indoors maskless and what they can do to help protect the children around them that cannot yet be vaccinated.
Yeah, so this is a touchy, a little bit confusing subject. So a group of people that know each other, they meet, they have children. So the adults are all vaccinated, that's great. But the kids are out in school and daycare and playing and whatever, they are not vaccinated. Now the Delta is so contagious that it's highly likely that one of them is going to get infected at some particular point. I mean, at least it's a possibility. So when you're together, it's really best indoors. If you've got unvaccinated people, to wear masks, if at all possible, or you're just going to have to accept the risk that it could spread among the children and maybe even to the adults. Although you're still going to be 90% preventative of getting the vaccine. Now, the good news here coming up very soon is that in September, it's been reported that it's likely that the emergency use authorization for these vaccines, at least the Pfizer vaccine and maybe Moderna also shortly after, because Pfizer was first, may be approved for kids 4 to 11 years of age. And so then at least all those school and preschool age kids will be eligible for the vaccination. Then you can actually really get a group of people together vaccinated, and that would be the safest.
Wow, that is really great news to hear.
Mm-hmm.
So another viewer who works in a clinic kind of medical setting was vaccinated nearly 7 months ago with the Pfizer vaccine, and they and their coworkers have been testing their antibody levels and have found significant decreases in those levels. And they're concerned about whether or not they're truly protected from COVID at this point. Is there any information on who or when could get a booster dose or something similar? And are they relatively protected still?
Yeah, the regular off-the-shelf commercial antibodies that these people are getting, I'm presuming it's the one of the commercial antibodies that's approved, are different antibodies than the antibodies you make against a vaccine. So they're measuring they're measuring the wrong antibody. And you can't actually measure the effect of the vaccine based on those commercial antibodies. That's one point. Second point is there's a big whole part of the immune system that has nothing to do with antibodies. It's called T cells. And those are really very sophisticated part of the immune system that really helps prevent disease, prevents you from getting sick, prevents you from going in the hospital, prevents you from dying. So they have nothing to do with that part. So the fact that you have a commercial antibody titer going down is kind of interesting, but it's not anything more than interesting. It does not mean that you need a booster. Matter of fact, no boosters are recommended right now for people, for anybody. Now, in Israel, Germany, and France, they are allowing a third dose on top of the 2 doses or the 1 dose of the Johnson & Johnson for people who are immunocompromised, which is a variety of people on steroids, people with organ transplants, all sorts of immunocompromised cases, even elderly are thrown in some cases. They're allowing a third dose, but it's actually technically not a booster. It's actually, they're calling it part of the primary vaccination series. And we do different things with immunocompromised patients already with vaccines. I mean, this is nothing new. Influenza is the most common one. You know, you're immunocompromised or you're 65 or older, you get 4 times the normal dose. Same thing with hepatitis B virus. The dose is much higher in people who are on dialysis or you know, they're also immunocompromised. So we do change doses and dosing sometimes in certain conditions, and certainly that will be the case here. And I think the first group that is offered this third dose will be immunocompromised people. We're going to follow, I believe, Germany, France, and Israel, and that will be the first one. And I think that's going to be pretty soon because the data are pretty clear. Those people do have an improved a real immunologic response measured in a very comprehensive, specific way. And they would likely do much better if they get that third dose. So that's going to come first. And then when we start seeing real failure, not breakthrough infection, but real failure of vaccines, in other words, way more than expected, that's when the boosters are going to come in.
Right, great. And I know you touched on this a little bit earlier, but there has been some confusion with the CDC's announcement of new testing recommendations for people that are fully vaccinated. And people are a little bit confused on what is considered a true COVID, exposure for someone who is vaccinated or someone who is unvaccinated.
Well, now, unfortunately, because of Delta, any exposure to a person known to have COVID or highly suspected of having COVID for even less than a minute puts you at high risk. Now, it used to be, I don't know if you remember, it used to be 15-minute exposure over 24 hours. Now it's just less than 1 minute. So that tells you how contagious this Delta thing, really is. It's very close. So testing has become very important. And again, and the really good news here is that we have dozens of tests now. We can test everybody in the United States multiple times. You can go to the pharmacy and get home kits and test yourself. There's testing facilities everywhere. It's really quite amazing the increased capacity we have in testing all through the U.S. government program called RADx, Rapid Acceleration of Diagnostic Tests. This program ramped up testing like you wouldn't believe. And so we have all different kinds of options. And many of the ones are very simple. You can do it at home. The trick here is, PCR is like our, the gold standard, And only very sophisticated laboratories can do that. But some of these other ones, they're good. They're not great, but they're good. And if you do them multiple times, it's as good as doing a PCR test. So say you get exposed, really exposed, a coworker or friend or something like that. You can go to the pharmacy now, or you can have your doctor order you a test, and you have them at home. And starting at about day 4 or 5, you can start testing yourself and the other people that had been exposed to that person. You would test yourself every 36 hours or so, 36 to 48 hours. You do that a couple of times. If you do that 2 or 3 times, you're negative, most likely. Now, if you get symptoms, that's a different story. I'm talking about asymptomatic exposures. So if you're symptomatic and you do a test and it's negative, you may have to bump yourself up and get over to somebody with a molecular test.
Mm-hmm. Wow. And for our last question today, this is something that we did touch on in the headlines, so it's a little different, but a parent was concerned because the school board for her child's school had made masks optional. Now we know that that's not going to be the case.
Nope.
But they were wondering, what are the best types of masks for kids to wear if they are going to be around other unmasked people or just in general at school?
Yeah. So the mask thing has come really full circle. Matter of fact, 2 times in the United States, and masks are back, unfortunately. And basically any kind of layered mask is going to be very helpful. It's indisputable that masks work, indisputable. Anything with layers. So the CDC on their website has a whole thing about what's a good mask, what's a bad mask, whatever. I highly recommend you check out that website. So you just make sure it's got layers. You make sure also that you wash them if it's a reusable mask. If you get those little blue surgical ones, those are meant for one-time use. A lot of people use them more than once, but they're designed really for one-time use. So, they're not going to work for very, very long. They're going to fall apart is what's going to happen. Just use those masks, use common sense. You don't have to wear the N95 masks in most situations. They're very, very tight and they're really, really hard to breathe. They're hard to wear for more than, a couple hours at the most. We wear them when we go in a room with somebody with tuberculosis or something really serious like that. And you can hardly, it's very difficult to wear them. And you also can't understand what a word they're saying because it's so tight around your mouth. So, you just hear people mumbling, but the regular masks are fine because they catch the big droplets that are coming out that are infectious. And they also prevent people with droplets getting into your mouth and nose, which is where most of the infection takes place.
Wow, that's so great. Well, great news. And again, great to hear that we may be getting kids 4 to 11 vaccinated in September. So keep an eye out for that. But thank you so much, everyone, for submitting your questions. And thank you so much, Dr. Murphy and Kristen, for your time. And thank you so much.
Thank you, Katie.